All right, and we have officially reached the top of the hour. So hello and welcome, everybody. We are so thrilled to be including you all in another edition of the ATI Talk. My name is Amanda Jameson. I'll be one of your hosts today. Before we get started and I introduce everyone who is joining in, just a couple of housekeeping items to make sure everybody is aware. We do have all participants muted for sound quality. Partially because we're recording and also because there are a lot of you joining in today. There will be the opportunity to ask questions still. There is a Q&A button at the bottom of your screen that you can use to chat in questions to our panelists. We have wonderful panelists joining us here from our integration specialist nurse educator team who are happy to answer what they can and when they can. So be aware they are there to help you out. And make sure you do have your phones ready to go because we're going to have some interactive activities in the middle of our session today and some QR codes for document download if you're interested in them. But before I go too far, I would like to introduce Dr. Janet Mcmahon, my co-host, and I will let her say hello.
Thanks, Amanda. Can you hear me okay?
Excellent.
Wonderful. Welcome everybody to the ATI Talk. We're thrilled to have you today. We have an action-packed agenda like you probably haven't seen. So the 90 minutes is going to fly by. So I want to take the time to welcome all of you and thank you for coming. This session is being recorded so that you can take a listen to it later on. Right now, I'm going to skip right into our introductions and let you know who our panelists are today. Our first panelist is Dr. Patty Knecht. She's our Vice President and Chief Nursing Officer at Ascend Learning. And she leads a team of helping students in healthcare careers along with aligned faculty and institutions, helping them achieve their outcomes through integration and educational technology solutions. Patty has an array of experience for over 40 years, and she works with an amazing team of industry experts at ATI to help us develop these innovative products and maximize the data analytics aimed at achieving excellent student outcomes with programs. Patty has a wonderful work history. She was a division chair at Immaculata University in Pennsylvania, where she oversight the BSN, RN, PN, she did it all, and MSN programs. So she's very well known. She's a fellow from the National League for Nursing, and we're just thrilled to have her today. So she'll be talking to us about the State of the Union. Our second guest today is Mr. Jason Schwartz. He is the Director of Outreach at the National Council of State Boards of Nursing, where he shares a lot of information to the stakeholders regarding the NCSBN examination services and all the offerings that they do. But prior to joining NCSBN, Jason has spent time with Pearson VUE for about 10 years supporting Nclex and other NCSBN programs in various roles at an executive level. He holds degrees in mathematics from the University of Oregon, I think that's Go Ducks, and the University of California, Berkeley. Sorry, Jason, I love my football. So I'm going to turn it back over to Amanda. We're going to share that agenda real quick, and then we're going to get started with the ATI Talk.
Thank you so much. So we are going to start out here with Dr. Patty Knecht giving us an overview of the current state of nursing education. Then we will be having Jason share with us the latest and greatest information on the Next Generation NCLEX project. And we're going to wrap it up with a review of some of the ATI resources to help you share with your students some of what you learned today. And then, of course, we will have that Q&A at the end. So don't be afraid to put those questions into the Q&A for us to answer towards the end. So Dr. Knecht, if you would like to take it away.
Thanks, Amanda. I appreciate it. So I am super excited to be here with all of you today. And may I just start by saying welcome back. It has been a probably crazy start to the fall for many of you. Some of you might be on a different cycle, but I'm sure everyone's moving in a very fast direction as we finally get on the far side of COVID, but still feel some of those impacts, maybe in learning loss and others. So what I'm going to talk to you about today is the numbers really do matter. And what you're going to find is that I'm going to do a quick introduction because I don't want to keep you too far away from the real reason that you're here today, I'm sure, and why you jumped on. And there's almost 1,000 of you, I think, on the call, and we have over 2,000 registered that came to see and hear from Jason about Next Gen. But to start, I wanted to share with you some quick statistics. And the reason I wanted to do that is because many of you are in such instrumental positions as faculty, as deans, as directors. You are in a very important time in our nursing education history. And I say that because we have a crisis in hand. We have the perfect storm that's brewing. Some of you who have been around for a couple decades will remember in the 80s when we had a similar perfect storm and we barely crawled out of it. So as we look to our future right now together, it is all of you who, armed with really strong evidence and armed with evidence that you will be able to see people turn heads, will help us move in the right direction. And what do I mean by that? These numbers and this evidence can help you in terms of getting more headcount for your particular nursing division, in making sure the right programs that you're focused on, that you're growing, that you're offering in your community, et cetera. So when we look at that perfect storm, one of the really strong pieces of information is that LPNs, RNs, advanced practice nurses, they're not going anywhere in the healthcare system in terms of diminishing in numbers. They are just going to continue to increase. And we know that from all of our government sources. So you can see LPNs and RNs have a 9% growth rate through 2030. Advanced practice nurses, 45%, as we look to changes in how we deal with populations, et cetera. We couple that then, so this growth, we couple with this retirement of nursing faculty, that 1/3 of nursing faculty are expected to retire in just the next couple years. The aging population continues to soar. So by 2030, it's projected to be 82 million. And we put those three dynamics together and we know that we have the perfect storm brewing. Is that good for salaries? Yep, sure is. But it also can, in some cases, from an academic perspective, and one of the reasons I put down, probably in particular, that APRN average salary, is that we're also many times trying to recruit people who are being lured into other types of settings where they can work. And so it is that dynamic that's at play right now that we have to really be careful about and keep our eye on. Next slide, please, Amanda. So where is ATI on this? We love to always say we're your partner at your side. And we have just in the last week released what we call the Faculty Foundations Pathway. I realize it's really small on this screen. It's just to give you a little snapshot of what it might look like. And what this pathway is it is for everyone who's on this call, any type of ATI client. And it is a quick resource because we heard you say we've got all these new novice educators. Why are all these new novice educators on board? Because you can see what the average age is. We have a group retiring, as we mentioned. We also are committed with all of you to try to bring more diversity into this nursing workforce. And again, as we bring more people in, they might be coming with clinical roles and not necessarily the essentials of what you need to be a really solid faculty member. So this very simple foundations pathway talks about who are these nursing faculty? Why are they here? What do they need to know, etc. So we're not going to get into the specifics of this today, but it is to tell you that this is available to you, embrace it, and be able to use it in the first couple months this year. You can also see some other staggering statistics here about the faculty vacancy rate being 7.2%. And then a recent report that's just came out in 2022 that says the nurse faculty shortages are important factors driving pipeline challenges. So we're trying to get more people in the front door, but in the meanwhile, we've got schools saying, whoa, we don't have enough faculty in order to get them out the back door and make them safe practitioners. Next slide, please. So one of the things that's a little befuddling, I think, sometimes to all of us is when we hear about mixed stories out there. And what I mean by that is all the stories are accurate, right? That I'm sharing with you today, they're evidence-based stories, but they might come from a slightly different lens. So our colleagues at AACN do a fabulous job every year of telling us the story about student enrollment. And this year, from their 2021 data, they came out and said, we're still turning away 91,000 qualified applicants in 2021. Remember that they're referring to their database, though, of members, which is baccalaureate and higher. And most importantly, they were still seeing an increased enrollment trend in that entry-level BSN, although it's down a bit from the year prior. So another little yellow flag up. In red, in particular, I wanted to jump out there that the master's nursing program for the first time in years has shown a decline. And that transitions to almost 6,000, a little over 5,700 fewer students enrolled in 2021 than in the previous year. So what does that say to us? It says, wow, we have really this perfect storm, because not only do we all of those other factors I just talked about, but we have less people entering these master's programs, which are most commonly the pathway into nursing education. On the far right, before we leave that, Amanda, we have some information from ATI Nursing Education that says overall in all program types, we've seen a slight net decrease of about 5%. And then you can see that there are some areas and types of programs that are more likely to see decreased enrollments versus increased enrollments. The really good news is we have heard, though, from our clients that you all are pivoting quickly. You're putting programs in place, you're putting strategies in place, and we're starting to see that tide on enrollments change a little. So what do we want to do? We want to get those enrollments up. We want to get faculty in place, because we know it's just not baby boomers leaving the workforce. We want to be sure our students who are coming into this profession are embraced, come into a work environment where it makes sense to them and they want to stay, and that we prepare them. So you're going to see the very close alignment to why clinical judgment is so important, because we want them not to be scared that first year and be able to think well, act well at point of care. For sake of time, we'll go to the next slide, but you can see what I was reinforcing there as you looked at that slide was the fact that we've got groups under 35 for the first time in years are leaving our workforce. So it's our job to make sure our students who are coming out are secure. And then our provider partners' jobs to make sure they create a good work environment for them, which certainly has been tough through COVID, but we're skating on the other side right now. We're trying to move in the right direction. So you can see that from this slide that yes, we are worried. These new RNs, close to a quarter of them, leave that system within a year. And you can also see that first year turnover outpaces all other tenure categories in our provider partners at our hospitals and other healthcare institutions. So for those that were terminated with less than 1 year of service, constituted 83.3% of a hospital's turnover from this one study by NSI in 2021. And so the big question becomes, how can we make them want to stay? How can they feel more secure? Are they practice ready? Well, thanks to our colleagues and our friends at NCSBN, they saw this coming, they jumped in, they studied, and they really analyzed what do entry-level nurses do. And they realize they need strong critical thinking, clinical decision-making, and clinical judgment skills. So thus the buzz around clinical judgment. It's not just a buzz, it's the real thing. The clinical judgment model is what will create some stability in our workforce and certainly contribute to safe care. And when does that really impact it? I'm sure why so many of you are on the call today, because it's coming in April 2023. Compound this with the fact that because many of us believe because of COVID, we won't quite know all that impact yet till we have more studies, we have seen some recent NCLEX pass rate decline since the start of the pandemic and through the pandemic. We're starting to climb out a little. But in 2021, more than 70,000 educated RNs and PNs were repeat test takers. That's important, delaying their entrance during a severe shortage. So we're here to believe that as partners by your side, as strong group of women and men who really believe in healthcare and nursing, that we can move this needle. And so you can see that coming out of 2022, Q1 and Q2, although we have some slight declines from 21, it's nothing like the declines we saw 20 going into 21. So we're starting to turn that tide. And what we need to do is make sure that we're doing everything we can to be sure our students who are graduating are ready for Next Gen. So with no further ado, I'm going to hand off to who has become a great colleague to us here at ATI, really a good man who's out there doing this outreach, Jason Schwartz, and he's going to walk you through this countdown to launch. Thank you.
Excuse me, Patty, can you answer one question that came through chat and then we'll move on?
Sure.
What does the research reveal regarding the reasons nurses are leaving after a year or less than a year?
Yeah, so we are still looking and analyzing that deeply. There was, during the height of COVID, there was definitely some COVID impact. However, that is starting to mitigate and we're seeing less of that. There is definitely stress factors and work environment factors that are contributing to this. And there is also, as many of you know, nurses can feel somewhat as risk at new nurses when they are put in situations in which they do not feel adequately prepared. So that's the piece that I guess I'd like to emphasize today. But there certainly is more literature out there. Given that question, you know what, we would love to entertain down the road that maybe we'll do a little bit more around these statistics and what they mean, because we have a lot more we could share with you around how students are viewing enrollment also.
Thank you, Patty. Jason, it's all you.
Okay, it's such a pleasure to be here. So I definitely want to thank the ATI team for inviting me. And then for, it looks like about 1,000 people showed up. That is just incredible. And I say this in all sincerity, in my mind, the two most important professions in the world are nurses and teachers. And I think so many on this call are both. So that's just incredible. It's an honor for me to share the information I have. I always start with my small print. If you see something, share something. Almost all the nurses out there are on this call, it looks like. But no, seriously, if you have colleagues who benefit from this information, please share it freely. If you have students who benefit from this information, same thing. Commercial use, we've got the small print email address. You just check with us first, but then we're good to go. All right. So my outline today, some of you I bet have been to things I've done and you've seen some of my presentations. Today's going to be a little bit different. It'll be some of the same, but some new. What are we doing? I'm going to give you a quick tour of the NGN case study. I picked that out because that really is the single most evident, visible, and prominent change coming to the exam. We've tweaked a few things under the hood. I'll talk about those a little bit. You may have heard of bow tie items or trend items, but the case study is really the biggest. So I want to focus on that. And not only am I going to do my own show and tell, but then you're all going to get involved we may break the internet with 1,000 of you typing in your answers, but I'm going to try. Interactive item writing exercise. That's where you come in. Be ready to scan a QR code to get involved on that. What else? Well, I don't want to skip the other things that are changing about the exam, so I'm going to give you a quick overview and point you to where we have more information, and obviously ATI has a lot of information as well. And then as long as I don't go too far over, we are allowing plenty of time for audience Q&A. Okay, well, measuring clinical judgment, not so easy, right? In fact, that's why not too long ago, 2012, when we were huddled up at our NCLEX examination committee meeting room and the question came up, is this something you can do? We weren't sure, right? We've done a lot of research and we are literally 10 years in as far as figuring it out and getting ready to make it happen. I like to say we're not slow, we're thorough, but literally we've been working on it for 10 years. At its core, to measure what sometimes is called a soft skill in testing, clinical judgment, communication, critical thinking, problem solving, sometimes you have to break it down into simpler pieces. And in our case, I'm going to highlight layer 3 in this clinical judgment measurement model we developed. And it's 6 boxes: recognize cues, analyze cues, and so on, through evaluate outcomes that we've determined we can test, right? It's easy to test facts. It's easy to test immediate applications of concepts. It's harder to test these soft skills, but essentially what we found was that we could test these 6 things that essentially add up to the whole. So before we leave this slide, I'm just going to emphasize for educators, every new clinical judgment item going on to the exam targets these boxes. And in fact, as we go through the 6 items of the case study, and you see 6 boxes here, that is no coincidence. The items in the case study follow these 6 boxes in this exact order. So case studies are the biggest, most visible change, but we also have ways of measuring clinical judgment that we'll be introducing in April that don't take quite as long, right? The case study, as I've alluded to, is kind of a 6-pack worth of content. It's 6 items and a pretty robust scenario. We have come up with what we call trend items and bow tie items. Well, that's just 1 item at a time. It attacks clinical judgment. By the way, those 6 boxes you just saw, it is looking at those same exact boxes, but instead of 6 items, just 1 item, a little bit more measurement information, doesn't take quite as long. Okay, so how about that case study? Quick shout out in the upper right-hand corner, you see a little thumbnail, I suppose, of my spring 2020 NGN newsletter. Anything I cover today and anything I don't cover has an NGN newsletter where you can read much more about it, go in depth, kind of read at your own pace, etc. I highly encourage these. When people say, what's the best thing on the website if I want to learn about NGN, I point people to the newsletters. And honestly, spring 2020 case study is my very favorite one. Okay, let's jump in. So sample case study, we're going to just click 7 times or so just to put some numbers on the map. What are we doing here? Don't worry if you can't read the small print. I can't either. This is just mapping out for you what the case study will look like for your graduates. Where you see the bright number 1 that I've added to the screen, that's just letting them know, okay, here it is. It's one of the 3 case studies you need to do. And by the way, you're on the very first item, right? If they're wondering, am I almost done yet? And they see screen 2 of 6, well, sorry, ways to go. If they see screen 5 of 6, good news. Almost light at the end of the tunnel. Where you see the number 2, there's no technical testing term for that. I may need to invent it. Maybe we'll call it the Jason someday, but no, I just call it setting the table, right? That's all it is. It's literally just always 1 sentence at the beginning of the case study that just lets people know, big picture, here's where we are and what's happening. Okay, where you see the 3, 4, 5, and 6, well, that is our scenario. We are presenting an abundance of information, real world nursing information, and we've organized it into tabs. I should emphasize there's nothing magic about 4 tabs. There could be 3, there could be 2, sometimes there's 1. But what else? Pretend there's 4, like this one. Sometimes another tab shows up later, right? That's very common in ones where we don't give the lab results right away, and maybe midway through the case study, the lab results arrive, right? And then a new tab shows up as well. So it's not a magic number, but the main thing, big picture, is there is a lot of information on the left-hand side. We call it the scenario. We organize it into tabs. Over on the right-hand side, well, that's the actual question, or in my profession, we call it the item, right? It's the thing to do, the thing to answer. You get the idea. So with that, we're going to enlarge half the screen so we can actually read it. And here you go. So I do want you to know we have enlarged this just for our viewing ease, but your graduates in the testing centers will always see both sides of the screen at the same time. Nothing disappears for them. All right. So the nurse is caring for a 17-year-old male client who reports a recent injury to the left thoracic cage. That's just us setting the table. I'm not going to read word for word everything we have here. You can kind of skim it. Mostly, I'm going to focus on the questions and their connection to the clinical judgment measurement model. And then we're going to go deep in the interactive activity into one of these. But okay, so for now, we'll just say that was the history and physical. There's quite a bit there. We've also got some nurses' notes that add to our understanding of the client. We've also got vital signs. And last but not least, in this particular case, we've got lab results. But before we go on from here, I'll point out something, right? Bonus content from Jason here today. Notice reference ranges are provided. That is a new direction for the NCLEX, right? Coming April 1st, 2023. You may know today, you may tell your students today, ooh, you might need to memorize 20 or so different reference ranges or normal ranges so you can interpret lab values on the exam. Well, one of the things we're doing here, we're trying to get much more real life, right? Well, real life is the lab tests these days come with the normal ranges, therefore the exam will too. So that's a nice friendly change coming in April. With that, let's jump in. And we are looking now at the right-hand side of that very first screen. It's the very first item, right? So imagine that your graduate has digested all of that information on the left-hand side, kind of thought it through. Maybe a picture is forming of what the client needs or what could be going on. Well, where do we start the case study? Let's take a look. Which of the following assessment findings require immediate follow-up? Select all that apply. Before I even interpret what's happening in terms of the clinical judgment measurement model, let's just click once to get the item type. You all know, select all that apply. That's a fan favorite everywhere I go. In our shop, we call it multiple response. We're always a little different. We have our own jargon at NCSBN. So the point is, we call this extended multiple response because it has some extra answer choices. In your world, you can call it extended select all that apply, and that's just fine too. But the point is, it's a very familiar item type, but one of the ways we found we could measure clinical judgment better is to allow ourselves to have more than usual the number of response options. Before we jump forward too much, let's just key back in on what the question was here. Which of the following assessment findings require immediate follow-up? I didn't read it all to you, but you certainly saw there was a lot of information. If I had to guess, I'd say there were about 100 facts or 100 pieces of data in the scenario. If you talk to a new nurse or a recent grad and you say, what's important out of these 100 things? They might just say, probably all of it. And they might not be wrong, by the way, right? But you can't really take action on 100 things at the same time, right? So what's the most important thing? And I can say, even outside of nursing, sometimes at your job, the most important thing is to say, well, my gosh, look at all this stuff I have to do. How am I going to figure out what the most important things are, right? So at any rate, in the nursing context, we call that recognize cues. And that is how every case study will begin, right? Not necessarily word for word in terms of the question. Sometimes instead of select all that apply, it might say select the 3 findings that require immediate follow-up, right? Or sometimes it'll phrase it just a little bit differently. But the point is, at the very first item in the case study, it is all about, here was a tremendous amount of information because that is real world. Can you pick out kind of the red flags, right? What are the things that should get your attention? What are the things that require immediate attention? As educators, you might say, that's great, Jason, but we also want to know if our students know why those things are important. And I would say to you, we don't do that with the first item, and it's not because we don't care. It's because we do that in the second item. So let's take a look at that. Here we go. Which of the following potential issues is the client at risk for developing? Select all that apply. We can click once and see that item type once again is extended multiple response or extended select all that apply. But all of a sudden now there's some analysis or interpretation, right? We're making some connections. Hey, these things are important because, right? This client might be at risk of developing X. So in terms of our clinical judgment measurement model, let's take a look. Analyze cues is the name that we give that. That is always the second question in the case study. It's essentially connecting some of the cues, or I say clues sometimes, to each other, or connecting them to get a better picture of what might be happening, right? How do these cues relate to something else that we care about? A complication, a condition, or disease process. All right, let's see where we go from there. Third item in the set, it's not a select all that apply. I brought some extras today, right? I have some extra stuff. The nurse is initiating the client's plan of care. Complete the following sentence using the list of options. We name this item pull down menu. We weren't feeling very creative when we cooked up these item names. Pull down menu because you pull down a menu. So how does it work? Well, the nurse should first address, and there's a pull down menu, and you can choose abdominal pain if you like, but your choices might be abdominal pain, respiratory status, lab results. There's a second menu. I didn't program it to click or open, so we'll just look at it closed. But the point is those same choices would be in that second menu as well. So if you had to say in a word, what's going on here, I think you would say prioritization. Sure enough, if we go to our clinical judgment measurement model, that third box that always goes with the third item, we've named prioritize hypotheses. I try to give bonus information whenever I hit the road, so I will do it here. Prioritize hypotheses, I believe you'll see as you look at more examples, including the one we just looked at, comes really in two flavors. Sometimes there will be explicit hypotheses, like, oh, the client is exhibiting X, most likely because of Y and Z, right? That sounds like hypotheses are pretty explicit, but sometimes it's like the one you just saw. Well, we're going to prioritize the respiratory issues before we deal with the pain, right? That kind of thing. And in that case, I think the name still works because there are hypotheses that indirectly are informing those decisions. Nonetheless, sometimes I nickname it in my head, prioritize conditions, right? Or prioritize some aspect of the client status. So when it comes to prioritize is the key word, whether you see hypotheses or whether they're a little bit more implicit. Okay. We have just hit halftime, by the way, of the case study. That's an important milestone. We've made it through 3 items, but it's not only important because, hey, that's half, but I would also say that the case study takes a very important turn from the first half to the second half. I like to describe the first half almost like the nurse as a detective, right? We are trying to figure out maybe what's going on here, right? What do these things mean? What's happening, et cetera. But you'll notice there haven't been any items yet in those first 3 that deal with what are we going to do? Well, the second half of the case study is much more action or intervention oriented. It's all about what are we going to do in terms of what's our job there? Well, of course, it's still nurse, but sometimes I think nurse as magician, right? The nurse now is looking to transform or improve the client status through the various tools that nurses have available. So an important landmark, we've just gone from the sort of detective half to the magician half, unofficially. Anyways, let's take a look. The nurse is speaking with the physician regarding the treatment plan for the client who was just diagnosed with a splenic laceration and left-sided hemothorax. For each order, click to specify whether it's anticipated or contraindicated for the client. So first, let's talk item type. This is, we call it matrix or grid. We've got 2 names for it. I don't know if that's, consider it bonus. 2 names. Hopefully it doesn't confuse folks. So we use matrix or grid as the name whenever the responses go into rows and columns. And so in this case here, echocardiogram, do you think it's anticipated? Okay, bubble that one in. IV fluids, contraindicated? Okay, bubble that one in, right? You may have other answers, by the way. So what are we really doing here? Well, the new nurse or the graduate is essentially connecting the client's needs, right, to the toolkit or the interventions that might make a difference. Now, it doesn't mean that every single one of those things will happen or that every single one of those things will happen at the same time. An example I give sometimes is your family's trying to decide where to go to dinner, right? And you might, there might be 5 suggestions and they're all valid. They're all terrific. Somebody approves, right? But you're not going to go to all 5, right? That'd be a lot to eat. So in this case, sometimes I think of this almost as a little bit of brainstorming. What are some things that could help? Doesn't mean we're going to do them all, but what are some things that could help? What are some things to avoid? Let's take a look at what that is called in our clinical judgment measurement model. Generate solutions, almost like a brainstorming, I would say, right? But all about what could help, what might not help. Doesn't mean we're doing it all. Doesn't mean we're doing them all right away, because that's next. That's next. Let's go to the next item. And here you can see we really are getting ready to do some things. So the nurse has been asked to prepare the client for immediate surgery. Which of the following actions should the nurse take? Select all that apply. Well, you know the item type. We don't even need to click, but we will. This is our extended multiple response again. We can click it, Amanda. Yep. And in this case, well, here we are, the new nurse preparing the client for surgery. Check off the boxes. These are the things we're really going to do. So take action and generate solutions. I will acknowledge are probably the 2 most easily confused as I meet with educators and they say, I think I get it. And I think I get that layer 3, but I get these 2 mixed up. Well, good reason. Both of them are about various interventions or actions. I would just say generate solutions is kind of as you're formulating a plan and thinking about what might help. Take action is much more, okay, we're doing something now, right? But they're both obviously very connected. Let's now go to the end of the set. We've made it to the 6th item, and don't celebrate too much because I'm about to put you to work. But here we go. Click to highlight the findings below that would indicate the client is not progressing as expected. And if Amanda were to click on a sentence here, she would see it light up. She would see that she has highlighted it. She's highlighted another. Guess what we've named this item type? Highlighting. Yeah. Okay. We'll hire the creative writers next time we change the exam. We didn't do it this time. But what's going on in terms of the clinical judgment measurement model? Well, just like the nursing process ends in evaluation, we call ours evaluate outcomes. But what's it all about? Sometimes just plain English, I like to talk about the client existing as a before and an after, right? What's the before and after? Well, before is kind of how we first encountered them, right? Here were all the aspects of their situation. After is after some interventions happened. Well, can your graduate tell which things were kind of positives, right? Maybe some things that got worse. Are there some things we need to keep an eye on? And that is how every case study ends. In the real world, the nurse wouldn't now walk away, right? Because sometimes you evaluate those outcomes and you say, ooh, there's more to do, right? You've recognized some cues and the whole thing starts all over again, believe it or not. But for testing purposes, we're done with the case study. 6 items and we're through. So I think I'm just gonna highlight a few key features. I gave you the lightning tour because we're about to go into one ourselves and work on it together. Key features, real world, right? And this was a very explicit instruction to our item writers. Give us real world, right? Sometimes people kind of make fun of Nclex. It happens when I go on the road and they say, Jason, Nclex is like, it's not real world, it's Nclex land. Everybody has one thing wrong and needs one thing done. Real world, everybody has a lot going on and needs a lot of different things. And, okay, all right. Well, you may or may not fully agree or endorse, but either way, the explicit instructions to the item writers for these scenarios and the items that follow are real world, even if it's messy, even if it's a lot of information. A lot of information is not a bug, it's a feature, right? Because how else will we know if somebody can wade through a lot of information and pick out the most salient info? Well, you got to give them a lot of stuff or you can't really tell. Progression through time, if you were paying careful attention, I think you saw we got to post-op day 3. So we spent a few days with that client, but more importantly, as a testing person, I'll say, we progressed through those 6 boxes in layer 3 of the measurement model in order. I don't want your takeaway to be, when you see a case study, ooh, 6 random complicated questions, what do I do? No. They could be a little complicated. I'm not going to walk away from that, but they're never random. They follow those 6 boxes in order. First one, always. Here's a lot of information. What do we need to worry about right now? Second one, how come? What does it mean? How does it connect, right? They always go in that order all the way through to evaluate outcomes. Range of content knowledge, I think you saw that. Some new item types. Some are just familiar twists on things you already know, like the SATA, but adding a few choices, and others like highlighting, matrix grid, or the pull-down menu are truly new. Okay, y'all. We might break the internet. We might just break the internet, but if you have your phone, scan the little QR code with the dinosaur, or you can just text ATI testing 414 to 22333, or you could kick it old school and join by web. Try to do one of those three things. If you can't, it's not the end of the world, but if you can, then you get to participate in this interactive activity on screen. If you can't do these things, you can still kind of participate at home, kind of like how we all watch Jeopardy at home and shout out the answers. But Alex Trebek and Mayim Bialik don't really hear us. Okay, so anyways, or when I was rooting for my Oregon Ducks, and evidently they didn't hear me against Georgia. All right, so we're gonna just try this out. If you have done one of these three things, then you have perhaps been prompted with a little thing where you get to type in an answer. So let's just see what happens. I hope we don't break the internet, but go ahead and tell me, how are you feeling about the changes coming to the NCLEX? Maybe one or two words: excited, nervous, you name it, and let's see if our technology works. Oh my, our technology works. There are so many words, I can't read them all. I think I'm seeing thrilled, excellent, outstanding, fantastic. I don't know if there's any negatives. I don't think I see any negatives. I think I'm just seeing extremely positive sentiment.
That excited is that big one in the middle.
Yeah, we see the nervous and excited and intimidated, perhaps, but
yeah,
you're going to change
amazing.
all that today, right?
Yeah, I have a new prescription on my glasses. I only see the positive. All right, y'all. So congratulations. We are working the technology well. That was just the warm-up. Now we're really getting into it. So I mentioned y'all are going to work with me on a case study of our own. I will acknowledge I've never tried it with this many people, so I'm a little bit scared, nervous, anxious. We could go back to that last word cloud. You could pick out 10 more of those words where I am, but I think we're going to make it work, and the ATI team has put in a lot of pre-work to set the table for success. So let's see. Here's the scenario we're going to use. Kind of lock it in. It's still going to be there on the left-hand side of our screens later, but the print will get smaller. So nurse is caring for a 78-year-old female in the ED. 10 o'clock, client brought to the ED by daughter due to increased shortness of breath this morning. Side story, by the way, the item writer who wrote this for us, I swear wrote this like 3 weeks before COVID hit the world. So it was almost like predicted COVID. I mean, it changes as we go further, but I'm always, whenever I see the increased shortness of breath, right, nowadays, we all think COVID, but okay. The daughter reports that the client has been running a fever for the past few days, started to cough up greenish colored mucus, complain of soreness throughout the body, recently hospitalized for issues with AFib 6 days ago. Client has a history of hypertension. The vitals are 101.1 temperature, 92 pulse, 22 respirations, blood pressure 152/86. Pulse ox is 94%, but with some help here, 2 liters per minute, nasal cannula. Upon assessment, the client's breathing appears slightly labored. We've got coarse crackles noted in bilateral lung bases, skin slightly cool to touch, pale pink in tone, pulse +3 and irregular, cap refill 3 seconds. And there's more. Client is alert, oriented, person, place, time. Client's daughter states sometimes it seems like my mother is confused. Lock it in. Picture this client situation. We're going to do some things with it. So you don't need to rescan if you already scanned. The way it's been set up, you'll just get a new prompt when it's time. So you don't need to rescan the code. It's just there if you missed it the first time and want to play along. So I am going to work with you. You're going to work with me to build out this case study. We're going to start with the recognized cues. Friendly name for it, I say, is what matters most. So go ahead now, if you're prompted, and you're going to start typing in some client findings from the scenario that could be our keys, our correct answers. In other words, what do you see as a top 4 client finding requiring follow-up, something that you see as needing immediate follow-up, not something we can come back to tomorrow, something we really want to worry about right now. Go ahead and just type them in, and here we go. I got to turn my head different directions to read them. You can see them too. We've got some of you say fever, breathing, yeah, shortness of breath, crackles. And the way these word clouds work, by the way, the most popular answers, I believe, get the biggest writing. So sometimes that's a nice way to see what the most people are choosing. The oxygen, 94%, right? We see some other things. We see the blood pressure kind of in smaller writing, the temperature in smaller writing. Fantastic. Okay, so let's go back to our item. Well done, by the way. Well done. So thinking like an item writer, well, we needed 4. Y'all gave me about 20, but let's say if you're the item writer, you're going to pick your favorite 4, right? But we also need wrong answers, right? As educators, you probably aren't in the business of teaching wrong answers. As a testing person, I need wrong answers. So now go back to that same scenario, nominate some things that don't really need immediate follow-up. They wouldn't make the top 4. They might not even make the top 7 or 8. So again, same deal, and we'll hit the word cloud and see what y'all come up with. We're looking for wrong answers to this question. Okay, the pulse, the cap refill, it looks like, general soreness, love it. The statement the daughter made, the history of AFib, I think was one of ours. What else am I seeing? We are seeing, I think, the alertness or neurological status. Fantastic. Let's go back to our item. Y'all are doing just an incredible job, and we're setting a record for most responses ever because this is a good big crowd. So now we're going to take a look and see what the item writer came up with. And by the way, it doesn't mean theirs are better than ours, right? Because we always have a lot of choices when we write an item, right? So here's what the item writer came up with. I just want to point out 2 things to you. Thinking like an item writer, I always start with my answer keys, and then I go to my distractors, my wrong ones. However, if you leave it in that order on your test, your students figure you out pretty quick. They know the right stuff's on top, the wrong stuff's on the bottom. So we always shuffle when we're done. You don't want to forget to shuffle. And in fact, on the Nclex, we tend to shuffle shortest to longest. So if you're looking at that screen, you probably noticed that, shortest to longest. Other thing I'll say, thinking like an item writer, sometimes you say, well, I was thinking about doing temperature. I was thinking about doing pulse. Well, this writer, I really like what they did here. They used vital signs as kind of an umbrella term. And I just want to make sure you know, that's always a choice or some latitude you have as a writer. You can grab individual things, or you can sort of clump things together, right? It's all good. Okay, let's just go to the next one. So, analyze cues. This is probably my favorite item in the set, but it's going to be a little complicated. Be on your A game here, okay? Don't let me confuse you. This is a fun one. We have to take it in 2 parts. So for each client finding below, click to specify if the finding is consistent with the disease process of, well, something, something, or something, but it's covered up. So you don't know what the item writer did. So let's see what you would come up with. As you look at maybe the signs, symptoms, findings, data, you name it, what are some conditions or disease processes that you think might be it? It doesn't have to be exact. It doesn't have to be a perfect match. But what are things maybe that your students would think, oh, that kind of goes with X? Well, let's type it into the word cloud, and then we can fill out half of our item. Okay, pneumonia, I saw. Beautiful. COVID, yep. I gave that one away, but you would have got it anyway. Sepsis, influenza. Let's see, I see pulmonary embolism, I think I see emphysema, okay, good, okay, infection, COPD, beautiful, okay. So let's go back to our item, and now what we're going to do is reveal what the item writer went with. Oops, oh, not quite yet. Yeah, first just reveal. There we go. Okay, and we're going to kind of freeze it here for a sec. So the item writer went with pneumonia, UTI, and influenza. I think you all got those 3, and you got even more. So fantastic job. But now, just to complete our item, let's use these 3. Now your next job, your next thing to type in is out of the findings, out of the scenario, what are some things that are kind of interesting for your students or graduates to evaluate against each of these conditions? Example, soreness, right? If we chose soreness, well, then your graduate would say soreness. Does that go with pneumonia? Oh, shoot, I can't remember. Let me think. Oh, my aunt had pneumonia. What was she complaining about, right? You get the idea. So give me some findings that would be interesting to compare against pneumonia, UTI, and influenza. Doesn't have to go with all three, right? Okay, fever, crackles, confusion, great, shortness of breath, right? The cap refill, the oxygen level, urination, okay, sputum, right? The cough characteristics, beautiful, I love it. Okay, let's go back to the item and let's reveal what the item writer came up with there. A lot of the same things that y'all did. Again, I will just observe cough and sputum, right? In a way, taking two things and putting them together, right? That's always okay, right? When you're the item writer, you're in charge. Okay, beautiful. Prioritize hypotheses. Another tough one, but these are fun. Y'all are doing excellent. So I think you can handle it. Okay, complete the following sentence. Choosing from the list of options. Client is at highest risk for developing something. Well, you tell me. Let's just go to it. The client is at highest risk of developing what? What do y'all think from the scenario, from the cues? Type it in. Sepsis, pneumonia, hypoxia. Okay, we're seeing some good ones. And spoiler alert here, notice pneumonia and sepsis are about the same size. I love seeing the visual because most of the groups I've tried this exercise with, I'm going to say it's a pretty even split, right? By the way, I stole this item for my presentation before it went through all the reviews. So it may be, right? If this item went through all the reviews, the reviewers would actually turn it down. They'd say, there's kind of two right answers here. we can't really have two, but I still like to use it for my exercises. And of course, I think with educators, there are fewer rules, right? So if it makes for a teachable moment or interesting discussion, it's probably good, even if there might be two right answers. I wouldn't put it on the final, but you know. Okay, let's go back to the item. Okay, so, and now, as evidenced by, well, what kind of cues in the scenario are maybe hinting at what the client is at risk for developing? So you know the drill now, just type things in, and I think we're going to see all kinds of the same kinds of things we've been seeing a while, but let's see what you come up with.
Jason, you're doing such a good job. This is impressive.
Thank you, Janet. Thank you. And look at the participation. We're getting so many of these. There are records being set with every item at this point. So we've got quite a bit here. It's all good, but I'm going to show you something that the item writer did that to me I thought was kind of a clever trick, kind of a cute gadget. If we go back to the item and we reveal our menus here. So we had hypoxia, stroke, dysrhythmias, pulmonary embolism. Oh, that reminds me, I forgot to ask you for distractors on that first one. So that was my bad. But let's go to the second reveal. And with our second menu, the item writer again did some really nice grouping, in my opinion. Vitals, neurologic, respiratory, cardiovascular. So it was a nice way of taking a lot of different things and putting them all in one place. Again, you don't have to do it that way, but sometimes it's nice to see that we have that option. Let's head to the second half of the case study. Generate solutions. And what are we doing here? Well, by the way, we have new information at noon. Called to bedside by daughter, states mother isn't acting right upon assessment, client difficult to arouse, pale, diaphoretic in appearance. We've got the new vitals, temperature 101, pulse 112, respirations 32, blood pressure 90/62, pulse ox now is 91%, still with the 2 liters nasal cannula. So at this point, what are we looking for in this item? Well, for each potential nursing intervention, click to specify whether we think it's indicated or contraindicated. We saw an item like that in the first case study. Well, what are you going to do here? You're simply going to nominate some interventions that you think would be interesting to see if your students know indicated or contraindicated. That's really it. So go ahead and nominate some interventions. And I think on this one, I'm going to take a mix of right ones and wrong ones. So give me some indicated and give me some contraindicated. So increasing the oxygen, that's a biggie. And even as a math and testing person, I'm going to say indicated. Okay, what else do we have? Let's see, bolus, I've seen that one before. Antipyretics. Antibiotics, I've seen that one come through before. Fluids, changing the head of the bed. I think it might depend which way it changes, whether that's going to be indicated or contraindicated, but you got it. Okay. Cultures, yeah, I think something like request an order for blood cultures and sensitivity comes up quite a bit. Okay, let's go back to our item. And we can go ahead and reveal. And let's see what yeah, there we go. We'll just jump right in. And so the item writer, and you'll be the judge, right? My audience will be in the judge as to which one's the answer for each of these, but prepare for defib, place on semi-Fowlers. I think I saw that in the word cloud. Increase oxygen, administer IV fluid bolus, and the peripheral VAD additional. So those are the ones that the item writer went with. Okay, take action. What will we do? So same information on the left-hand side. The nurse has received orders from the physician. Click to highlight below the 3 orders the nurse should perform right away. But you might see that there are 5 bullets, meaning we're going to have a list of 5 orders. 3 of them are right away. 2 of them might be come back later, or you might even question the order rather than do it right away. But let's start with the keys. What are some orders the nurse should maybe anticipate and be ready to perform right away? Go ahead, type it in. Let's see what we get. Okay, yeah, the oxygen, we're seeing some of the very same things, and that's probably not a surprise. Oxygen being the biggest, right? Yep, increase oxygen, O2, yep, fluids, yep. Okay, now let's go back to the item, and this one's a little harder to write. What are some orders we might get from the physician that we could either kind of wait a bit to take care of, or we might even question? So that's a little harder, but if you can think of one, go ahead and type it in. With 1,000 people in the audience, we may just get the 2 that we need. Okay. Okay, restraints. All right. Something related to diet. Fantastic. EKG is a big one. Foley catheter is a big one. X-rays. Fantastic. So we're seeing a lot of things here. The key in writing the item, of course, right? For a high stakes test, we need to make sure we have 3 definite right answers and 2 that we can defend as incorrect. In a teaching situation, sometimes if you just have a lot of things that are going to generate great discussion, you can worry a little bit less about, how definitely right or wrong something is. But okay, let's go back, and we are now heading to the final item in the set, the evaluate outcomes. Oh yeah, that's right. I'm sorry, Amanda knew. Sometimes we like to see what the item writer went with. Okay, now let's head to evaluate outcomes. And what are we doing here? Big picture. Remember, we talked about the before and the after. Well, we've got these orders that happened that you can take a look at 12:15. If we click one more time, we'll bring back our nurse's notes so we can kind of remember the status of the client originally. And I think we'll keep that one up right now. But as we try to think about, hey, has this client improved, gotten worse, or maybe stayed about the same, we're going to come up with some assessment findings. But here it's important. Here, pay attention. Normally I say, go grab me something from the scenario. But this is a different situation. We're not grabbing from the scenario because that was the before. We need the after. So it's a little more like creative writing, right? If the pulse was 92 and then it was 112, that's great, but that was then. This is now. What's the pulse now? Well, I don't know, right? It could be whatever you want. Maybe it's 82. But the point is, what you're going to do for this is you're going to come up with some assessment findings that you think might apply after the interventions were performed that would be interesting to check off as improved, no change, or declined. So it'll be a bit of a smorgasbord here, but go ahead and cook up some assessment findings that could be the new status of the client, right? Right, so oxygen maybe went up to 94 or 95%, or it could have gone down to, I think I saw, yeah, oh gosh, 80%. I hope not, but it could, right? It happens. What else? Well, with the, let's say, boy, these move so fast, but if we think about the pulse, for example, right? Well, the pulse could be up now to 96. The pulse could be 98. Sometimes it's hard to tell what the pulse is and what the oxygen is, but you get the idea. You did a great job. Let's go back to the item. The main teaching I want to give here is that this is the one place you don't just grab things from the scenario, but you sort of invent new findings that aren't shown here, but are kind of the new status of the client. So let's do this. Let's see what the item writer gave us just for the heck of it. Respirations, blood pressure being 118/68, pale skin tone. What else do we have? Pulse, so 91% on the oxygen, and then interacting with the daughter at the bedside. One of the other things I'll just teach you here, sometimes when our item writers come in and they write these, they would write, instead of blood pressure 118/68, they might write blood pressure much better, or blood pressure back to normal, right? But you can see how that kind of gives too big a hint to your students. We would never do that on the Nclex. You want to be as objective as possible. You don't want to have those kinds of adjectives inserted. You want your students or your graduates to have to interpret the finding, right? So don't put things like nearly died from, right? That kind of stuff kind of gives it away. All right, with that, let's jump to the next slide. I'm going to close this out with a couple things. If you had fun at all contributing your ideas, I can see how good y'all are. You guys gave me great stuff. If you'd ever want to do this for the actual NGN or Nclex, we have yet another QR code, or you go to Google and you search on Nclex volunteer. First thing that pops up. Sign up. We'd love to have you. Sometimes it's in person, sometimes it's virtual. We can never predict what tomorrow is on that, but the point is, we would love to have you. In terms of that exercise, just closing the book on it. Why do I do that? We kind of raced through it. I hope we had fun, but sometimes that's what makes it stick. It makes the item types a little less mysterious, right? To kind of participate in coming up with those choices. But the other thing too, and you all, I'm sure, have fantastic resources at your disposal, but even still, sometimes what I tell people is if you're getting ready with whatever tools to create your own NGN case study, sometimes a really friendly warm-up is to take one that's already there, cover up the answer choices, and kind of write it yourself. And by the way, you could even go to the scenario, cross out some of the stuff that's there and modify it, right? Maybe we have a pediatric client, or maybe the pulse is low instead of high, right? You can do whatever you want. And sometimes that's easier than a blank page. All right. I think we are going to just jump to the next. And all I wanted to say on the next slide is, test design. Newsletter has it all. I'm just going to give a couple quick highlights because there's still more we want y'all to do. We can go ahead and jump here. The big question everybody has is about to show up on this slide. The big question everybody has is, okay, Jason, how different is the exam from today's Nclex? So go ahead and we'll take a look. All right, let's see it. I have a visual here. I think I'm going after lunch for some of your time zones. Well, pretend today's Nclex is the cheese pizza. I love to say if it were really a cheese pizza, students would finish faster and like it better. But even still, we're going to pretend. Is the NGN a hamburger, a spaghetti, a Caesar salad? Nope. Let's see what it is. It is a cheese pizza with some toppings. That's what it is. We've got a chart. I won't belabor the chart other than to say about it when I see it, that the chart, we'll give it a sec. There it is, the chart. More stays the same than is different. For example, exam length, 5 hours, Nclex, 5 hours, NGN. These numbers, by the way, apply to PN and RN equally. Total number of items that count. Well, 60 to 130 today on the NGN, 70 to 135. Not too different. Something I can be pretty definite on is the case studies. There will be 3 that count, right? When I first started presenting, people wondered if the whole test would be case studies. Not at all. Remember those pizzas. The overwhelming majority of items that your graduates will see on Next Generation NCLEX are from today's Nclex, right? That's the cheese pizza. Yeah, they're going to also get 3 case studies. And if you learn a little bit from our newsletters or other sources about the bow tie or trend item, they're going to see some of those mixed in, not too many, right? But fundamentally, it's today's Nclex with some toppings. Alrighty. What else is changing? Just a few highlights I can give. The test plan always updates every 3 years. There was a 1-year kind of delay on one of the 2 for COVID, but at any rate, here's information. This may be new to you today. For the 2023 test plan taking effect April 1st, the PN percentages, if you are familiar with things like, oh, this percent of the test is management of care, this percent of the test is psychosocial integrity, PN percentages are unchanged. They are staying the same from right now into the 2023 testing cycle. RN is changing. RN01, management of care, is going down 2%, and the second and sixth RN categories are each going up 1%, effective April 1st, 2023. We'll publish the full book January 1st, but some folks like to know early, so I'm giving you what I can. That takes effect April 1st. Partial credit scoring. You know today, if you miss a little bit of a select all that apply, you get the whole thing wrong. For NGN, all of the new item types will be scored with partial credit, and even today's select all that apply will be scored with partial credit. Scoring newsletter has a ton of detail on how that's going to go. Again, effective April 1st. Passing standard. Patty set the table for me on passing standard. So the new pass-fail cutoffs are literally being essentially debated and decided more or less at the moment, or being recommended. And then we typically announce them around December. It requires approval of our board of directors, and I believe it's going to happen at our December board meeting. Take effect April 1st. I'll certainly share the information as soon as it's public. So you certainly won't need to wait till April 1st, hopefully many months before that. Okay, with that, we have our Nclex Conference 2 weeks from today. I know many of you go to this sort of thing. It's about 6 hours, all NGN. I'll be the MC and host. And again, you've got yet another QR code, or you could just search on the web, Nclex Conference. Okay, final. I keep sounding like this is the last thing. Okay, this I think really is my last thing. I also just wanted to announce to this group, you're one of the first to know about it. We have at NCSBN a brand new website, nextgennurses.org, highlighted by, it's all NGN all the time, but highlighted by a free download after you click the legalese of 3 case studies for RN, 2 case studies for PN, and some of those bow tie and trend items. So if it helped you to see that example and connect it to the measurement model, you can do that at least 5 more times with that download. Or if you want to create some of your own stuff and you want to kind of do what I just did with all of you, you can kind of change the ones we gave into new things that you can use if you like. So it's a free download. There's also a guy I wouldn't necessarily trust to get it right, who's going to tell you the secret to computer adaptive testing, it looks like. Hopefully he knows what he's talking about. All right, where are we, Amanda?
We
all
are
right,
up to some questions. So we're
and
just
I'll just
a couple
turn it all
minutes.
back over to the ATI group in terms of moderating all that. So let me say,
Jason, great
Yeah.
job, and thank you so much for that information. Whoa, super. We are going to have just a few questions, but then we'd like to go out to the ATI side of the resources to let our participants know we have this, and so we're ready. But because we've been seeing a lot of activity in the chat, Amanda, do you want to just see if there's one question that, or some themes that are arising that we can capture first with Jason, and then we'll move to our resources and we'll come back to questions.
Absolutely. So the biggest theme I'm seeing in the questions is, will all the questions have lab reference ranges? Is that only the case studies, or will there still be knowledge items asking that the students know the reference ranges and be able to retrieve them?
Perfect. We had to think a lot about that. What we decided was if we only provided them in the case study, then your graduates, when they got to a case study, would frantically write down all these reference ranges because they might need them later on the test. And that just seems silly to us. So in fact, reference ranges will always be provided. Small exception, you could come to an item that says the nurse is working with the client who has a slightly elevated potassium level. Well, we may not tell you the level or the reference range. It's just, you know what that means, slightly elevated potassium, right? But the point is, you don't need to memorize the reference ranges for the rest of the test. We just kind of cross that off the list.
Great. That answers one of the biggest ones in there.
Okay.
Another theme that I'm seeing is, are students able to move between the questions within the case study? Can they go back and revisit an older question in the case study?
We get that a lot. One of the things you'll notice with the case studies is kind of as you go further and further into the case study, it kind of tells you what might have been the right answer before, right? As you get a fuller picture of what's happening, then you're like, oh, I guess I should have worried about the shortness of breath, right? So in our case studies, and this is really true of just about any computer adaptive test, I call it a one-way street. You can go forward, but you can't go backward. The good news is this: all that left-hand side information is going to follow you the entire time through the case study. So you never need to worry about, oh gosh, what if I forget some of the information? That will always be there, but you cannot return to prior questions.
Right. And another good one here. Can you please clarify the correct overall title for the layer 3? I've heard it as both cognitive functions and clinical judgment functions. Is there a difference?
Well, I'm just going to be honest and say around the office, I've heard more than one as well. So if you were to pull up that newsletter on the clinical judgment measurement model, whatever it uses there, I suppose we could call the winner, but it's okay. I mean, we use some synonyms as well. Sometimes I hear cognitive operations or cognitive components, cognitive skills. I hear a lot as well. So, yeah.
Okay. And then one more before we talk about some ATI resources and save some of these questions for the end. Can you remind them again how to access those newsletters on the NCSBN website?
Sure. So the simplest way, right? This is so true these days of almost everything. The simplest way is if you go to Google or your favorite search engine and you just type NGN newsletters, the first thing that pops up is going to take you there, right? If not, you'd go to ncsbn.org, click NCLEX and other exams, go down the left-hand side, find a link to NGN resources. You know, it's a lot of steps, but if you just do your search on NGN newsletters, you'll get right there.
Great, thank you. And I know some more are still coming in.
Yeah.
So I'm sure our team will kind of collect which ones we want to answer live here in a moment. But just a couple of key points to make sure that you know we are supporting you here at ATI. We do have a lot of resources available for faculty and for students alike. You can see another QR code up in the corner there. We just left them here. It makes it fun. Make sure you can get documents since we don't have a chat to drop them in. This little QR code is going to take you to our ATI Next Gen microsite. On there, we have a wonderful guide for clinical judgment. It not only goes into, you know, what is NCLEX, what's changing, all of that fun stuff. But it also has some great activity ideas to help you with developing clinical judgment in the classroom, clinical, lab, sim. Anywhere you're working with your students, we have some ideas to help you connect that. So you will also see as you move through the website, there are a lot more resources. When you go into that support life raft on your homepage, you will see that some of these are available right from there. So we have an item development guide that'll help you write some of these item types, give you some of those prompts to help you as you're putting together these cases. You're going to see our NGN item scoring guide. This thing is a one-page gem. It is a nice grid. It's going to lay out all of those new item types, the characteristics, the scoring rules. But you'll notice it has a link right on the top, and two of our wonderful colleagues put together a series of videos to help you understand all those new scoring rules and how they work. I did see some questions were coming through in the chat about how some of those items we looked at were scored. That will help you to interpret and understand that in very easy to understand videos. They're all under 10 minutes, very concise. Very, very helpful. Oh, I see a puppy up there. Sorry, I'm easily distracted by dogs. Back to it. We do have other resources as well for you as faculty. In your resources section, the left navigation menu, very bottom, resources. You go in to the second row of tiles, products and integration. You're going to see that a lot of our products that you use with the students have lesson plans. These lesson plans incorporate those clinical judgment functions or cognitive operations, however you want to call them, along with the nursing process to help make sure you are giving the student opportunity to practice utilizing these thought processes, that you're asking them the questions to make them target that same sort of information. So you will see those in there. For the student, in their NGN Prep, or not NGN, sorry, they're Nclex Prep tabs. See, now I'm just starting to throw wrong letters out there. The Nclex Prep tab on the student side of the site, you will see the Nclex Experience, RN and PN. We have both. They are going to have videos that they can view to understand what is Nclex, what is Next Gen, how do I prepare, item type overview videos so they can understand all of these new items, along with practice case studies so they can work through questions. They can see all of these new item types. Those ones do have nursing information in them, and that might be a little bit of a panic moment for some of your newer students. So we have something in between them learning about these new items and trying them out. And you'll find this under the test tab on the student side of the site. The clinical judgment practice questions. We call it the Nclex questions overview. And it is going to be a series of questions for each of these new item types we were talking about with just non-nursing content. Fluffy fun things like puppy dogs and rainbows. So stuff that they can go in, feel comfortable trying these new formats. We also have modules on clinical judgment and engage in Nurse Logic. We have some additional case studies. I have it here in the student resources, but it's really a faculty resource. In that resources section on the faculty side of the site, some of those products do have extra case studies the students don't have access to on their own for you to work through more questions. Of course, we've also updated our practice tests. We will be updating those proctor tests whenever we have a little bit more here in the coming months with the new test plan. And you are going to see that you have the ability to write these items yourself with the custom assessment builder. You can write all of these new item types. Coming soon, you'll be able to write case studies in there. So those 6 questions in order, one chart that grows. So you'll have that capability coming soon, but you already have the ability to write all of those individual item types. Janet, I'm sure you would like to add to that real quick. I know I just kind of...
Yeah, Amanda, great job. I just want to make sure that our audience knows we have the resources. The QR code will certainly take you there for that. And if you have any questions, you can always reach out to your ATI representative. We also have webinars that are continuously scheduled that you can look at under our ATI events page for this. And we are staying strong with our information and our robust resources to help you prepare for Next Gen in April of 2020. And while I think of that too, we'll be having Jason back probably in the new year. I think we're going to go live and probably do something together with, you know, Dr. Patty Connect. And as Jason has more information to share and have a little bit of a longer ATI talk coming up. So I don't want to hold up the troops here. We have more questions in the chat for Jason, and we want to give our attention back to him as the voice of NCSBN. So Amanda, let's take it back to Jason and Patty, and you know, let's bring this on home. We've got another 15 minutes or so to help out our audience.
Hey,
Right.
Janet, it's Patty. Amanda, I did type into the response to one of the questions, but honestly, I'm not sure if everyone can see it. There were questions about how to access the Faculty Foundations course. So I did type that in. I'm hoping our colleagues can see that. That is live and available to you. I know some of them even chatted with their sales rep already.
Great. Amanda, what else do we have for Jason? We have him,
Right.
and or Patty or anybody. Let's all chat. Let's talk.
Absolutely, yes. So I'm seeing a lot of questions around some of the content areas having case studies. So things like leadership, nutrition, community. Will there be cases around these areas?
Yeah, good question. Let me do my best to answer. So we give our item writers quite a bit of freedom, right? We encourage things like a diversity of settings, right? We give reminders that, you know, in terms of multiple issues, they don't all have to be, you know, it wouldn't be necessarily all the same thing, right? There could be, for instance, mental health or psychological stressors along with physical situations, right? But we give a lot of latitude. What that means is if the case study addresses the 6 boxes at layer 3 and the content itself fits the Nclex test plan, right? It doesn't go outside the Nclex test plan. We're pretty happy to have it. We don't have quotas. Let's say, for instance, there's not a quota on we need this many case studies that involve a leadership situation or miscommunication or documentation, right? As we build up our bank, you know, ideally, the item writers will hit those things with kind of a nice frequency, but it's not something that we control for. So that's a bit more discretionary with the item writers. If the question is, do I have those? Our bank is too top secret to answer it directly. But the idea is that those sorts of things would be eligible as long as the content fits the test plan.
And I know part of those questions were also referring to the ATI practice test.
Oh.
Janet, did you want to tackle that one there? Because currently we do not cover those areas with the practice test having next gen items, but will they in the future?
Was that towards me, Amanda?
Yes, Patty, Janet, if one of you would
Oh,
like.
sorry, I couldn't hear you.
Sorry.
Janet, I'm happy to take that
Go ahead.
one.
Sure.
I would answer it in this way. We are carefully watching and connecting with Jason and others to understand how those questions are going to be reflected on Nclex. And at ATI, we're having in-depth discussions with our content team in terms of how will we approach that. We actually right now are doing some outreach to our clients to understand what their related needs are. So stay tuned. As you know, we have a very large mass of information already ready for Next Gen, as Amanda shared, and we're going to continue to build upon that. But we want to make sure we do it the right thing and we're aligned with National Council.
Thank you, Patty. I have a question that I saw in the chat that I love this question because I think a lot of educators think about it. Well, Jason, will Next Gen be using the word except in any item type?
Gosh, I will be honest with you. I saw that one, and when I first saw it, I said, you know, I don't know the answer. I actually sent a note to one of my colleagues, but I haven't heard back just yet. So I will try to get back to the ATI team with that. And then if you have a method of circulating, feel free. But yeah, I need to find out on that one. I mean, the concept of, you maybe remember there was a highlighting item and we talked about something like, what are signs that the candidate or the client isn't getting better or something, right? So I mean, that idea of sort of things that aren't good certainly comes up, but whether we use the word accept, I need to double check.
Great, thank you for that. And we'll stay on our chairs waiting for that answer.
Okay.
And then and the other question, and I know you alluded to this, just to reiterate, when they're writing responses, the shortest to longest responses on all question types, correct?
That's typically what's followed. In some cases, if there's a logical reason to list something in a different order, we would consider it, but the default is shortest to longest. And the goal there isn't just that it kind of looks pretty, but it's really just a nice thing we can do that almost always shuffles the keys and the distractors.
Excellent. Amanda? I'm trying to scroll and look too.
No problem.
Hey,
I think
Janet, I'll pipe in for a minute there. Jason, there appears to be a couple of questions or thoughts around logits and difficulty of the exam.
Okay.
Can you address that?
Yeah, definitely. So usually when I hear logits and difficulty, I'm thinking people are interested in the passing standard, the pass rate, the pass-fail result, those kinds of things. So I mentioned just at the very end that we are essentially wrapping up the meetings and the work that results in a new passing standard recommended to our board of directors. Now, when I say new passing standard, what I mean is fresh for 2023. It doesn't necessarily mean different. It could be that the new passing standard is the exact same one as the one we've had for the last 3 years, right? But the point is, that is something that we are hopefully going to be able to share by December. In general, if the passing standard goes up, it means you need to do a little better to pass, hence the pass rate sometimes takes, or almost always takes, a temporary dip, but then seems to catch up quickly to what it historically has been. If the passing standard stays the same, then in theory, the pass rate tends to stay about the same. And if the passing standard goes down, well, then we might see a pass rate go up based on that. So when we set the passing standard, I will say this, it's not really focused on, well, what will this do to the pass rate? It's all about what literally is needed for safe and effective care by entry-level nurses, right? And so it's really the environment that influences that passing standard, right? If that job is demanding more and more and more, the passing rate tends to have to go up to reflect that. If the job now is about the same as it was 3 years ago in a lot of ways, then the passing standard tends to stay the same. One other thing I'll say, because it may be that the question wanted me to go in a completely different direction, is every item in the bank has a logit value, a difficulty level, right? And the way CAT works, where we think your ability estimate is, we try to find you an item that's just the right difficulty. Even though we have the partial credit scoring in the case studies and they're a little more complicated, they have their own difficulty levels as well. We can associate difficulty levels not only with each of the next gen items, but in fact with each score point of each next gen item. And we can even associate a difficulty level overall with an entire case study, right? And so similar to how CAT works, your ability estimate up to some point in the exam could control what case study you're going to see next. Final thing I'll say, just tying those things a little bit together, hopefully not confusing the whole world on this. But as you look at the case studies, I saw there was a question that said, how many points was it? The number of points per case study does differ. To give a quick example, if it's a select all that apply that has 5 right answers, that could be worth up to 5 points. But if there's 4 right answers as written, then it's only worth up to 4 points. So there's always going to be variation. Ballpark, 6 times 4 points apiece. Ballpark, not always, but about 24 points per case study. Something important to know with the partial credit. If you see a case study and you say, how's anybody going to get that whole thing right? You don't need to panic. You don't need a 24 out of 24 to have a trajectory toward passing the exam, right? If it's a really hard case study, maybe a 12 out of 24 is actually pretty good. And if it's a fairly easy case study, maybe 17 or 18 gets you there. But the point is, each case study has its own difficulty, and essentially what you would need on that case study to be above the passing standard or below is based on its difficulty. So, all right, hopefully I didn't lose the room, but.
Jason, what I love that you explained, and let me just maybe summarize quickly and tell me if I'm articulating it correctly. Some of the chatter out there is that Next Gen, in essence, by itself, type of questions aligns with a logit or difficulty level. But the reality is within the Next Gen questions, there's a variability of that difficulty level.
That is absolutely right.
Okay.
You said it better than I did. Yeah.
And I think that's a really good one to clear up for our colleagues on the call, because there is some chatter around that. And then, you know, I think the day that I had the aha moment in my past where I said, okay, it's all about the job analysis and safe care that creates that passing level, I'll call it in a very simple term, related to the logits. And that's the whole big picture, that it is really about what are you going to have to do on the job to deliver safe care.
You got it. Exactly right.
Good deal.
Sorry, I'm muted there. One thing that's coming up is this QR code is not functioning. Do you have a website to share with folks who are interested in signing up for the Nclex Conference?
I must have made my slides too early. They changed it on me, I guess. All right. Well, at any rate, you know, if folks just literally do a search 2022 Nclex Conference, it will be the first thing that pops up. But I think I have that in some other presentations I'm doing next week, so I better update my slides.
And then similar questions around where to find these cases again.
Oh, perfect. So you got to tilt your head sideways there, but it's there, nextgennurses.org, nextgennurses.org. And should I offer a scoop to this audience? Should I give breaking news?
You can. We love
Is
that.
that form? Okay, I'm going to give breaking news. This is the first group to hear it from me. For folks who stayed on the call, here's a reward. So nextgennurses.org. We're building out this website at NCSBN. Really is kind of a one-stop shop to eventually put all kinds of information that we think educators and even students will want to see from us on the Next Generation NCLEX, right? We don't get too deep into regular NCLEX. This is a entirely next gen focused website. Well, right now there's that free download with the 3 RN case studies, 2 PN case studies, et cetera, et cetera. It's pretty good. We are about to, it'll be a couple weeks, it could even be more, but we'll see. But we were about to also add to that over 100 RN and PN cheese pizza items, regular NCLEX, and we're not just going to put them in their own pile, but we're going to shuffle them so that the case studies sit in that gigantic packet the way the case studies would actually be on an actual exam, right? And so the idea there, it's just a PDF, it doesn't do anything, but the idea is if you flip through that PDF, it will give you a very accurate picture of what an entire Next Generation NCLEX looks like, counting the cheese pizza, the pepperoni, the red pepper flakes, the whole thing. So we are working on that. And if I ask my team, when's it going to be done? They'd say, well, gee, Jason, we are waiting on you to finish proofing it. So I'm the weakest link, but the point is we are aiming for very soon on that. nextgennurses.org.
Wonderful. Thank you. And
Sure.
don't forget, there are a lot of case studies in ATI as well to keep helping with this. So we have some wonderful ones to share as well in your resources section. We have a lot of those pre-written items already available to you in that custom assessment builder. Even if you're not using it for a test, you've got access to it to use with your students as you see fit. So don't forget, you do have a lot of resources available.
That's right. Well, we are almost at time. Is there any burning question, Amanda or Patty or Jason, that we see in the chat that we can answer? And we can try to answer some of these questions maybe after this session ends, but is there anything out there?
I think we have covered the biggest question.
I think we're good.
I think so too. So thank you everybody so much for attending today. We appreciate your time and attention. If you have questions, don't hesitate to reach out to your ATI team. We'd be happy to connect you with the right people to get you the right answers. So never hesitate. You can't reach out to the wrong person here. So thank you all again for your time and attention. Thank you to our wonderful guests for joining us. We really appreciate the excellent information you all shared today.
Thank you to Patty and to Jason and National Council for taking the time to join ATI today. We appreciate your words and your information. And thanks everybody for joining the ATI Talk. We'll see you in the new year.
Thank you, Jason. We appreciate the partnership. Thanks to all.
Always a pleasure. Thank you, everybody.
You guys are the best.
Thank you.